about the pathology of acute appendicitis. Acute appendicitis is the acute inflammatory process involving the appendix. It can involve any age group, but this is most commonly seen in adolescents and young adults. So coming to the pathogenesis of acute appendicitis, it is multifactorial, which involves obstruction, ischemia, infections, and hereditary factors. Initially, the acute appendicitis starts with luminal obstruction, which progressively increases the intraluminal pressure. So this obstruction is usually by small stone-like mass of stool or fecalith, or rarely it can be due to any tumor or mass of worms. The ischemic injury, stasis of the luminal contents, these two favor the bacterial proliferation, thereby they trigger the inflammatory response. So this inflammatory response leads to edema, neutrophil infiltration of the lumen. Also there is neutrophil infiltration in the muscular wall, periappendiceal soft tissues. Pressure produced by the inflammation and edema predisposes the appendix to the development of gangrene, perforation and peritonitis. So this is the pathogenesis of acute appendicitis. Next, coming to the morphology. Grossly, the appendix appears swollen and erythematous. The serosa is initially dull and grey in color. Later, it may be covered by purulent exudate. Perforation secondary to the gangrene can follow, and it can lead to the formation of an abscess. Next is the microscopy of acute appendicitis. The early lesions show mucosal erosions, that is the ulceration. Later, there is neutrophil infiltration in the lumen. The diagnosis is made when the muscularis propria has neutrophilic infiltration. This is diagnostic of acute appendicitis. Development of focal abscesses within the wall leads to acute suppurative appendicitis. When there are large areas of hemorrhagic ulceration and gangrenous necrosis, this leads to acute gangrenous appendicitis. So these are two conditions: acute suppurative appendicitis and acute gangrenous appendicitis. So these two are like complications of acute appendicitis, which may rupture, causing suppurative peritonitis. Next, the clinical features. The clinical features of acute appendicitis include pain in the periumbilical region, which localizes to the right lower quadrant. This is followed by nausea, vomiting, low-grade fever, and mild leukocytosis. Also, there is characteristic McBurney sign seen in acute appendicitis. The McBurney sign is the presence of deep tenderness located 2/3 of distance from the umbilicus to the right anterior superior iliac spine. This point is called as McBurney's point. So the deep tenderness which is located at the McBurney's point is called as McBurney's sign seen in acute appendicitis. Lastly, the complications of acute appendicitis. The complications include gangrenous appendicitis, perforation, portal vein thrombosis, formation of liver abscess and bacteremia. So this is all about the acute appendicitis, that is the pathology of acute appendicitis. Thank you.